last week, I know the medical technologists, basically, they came out saying that, well, if the government refuses to pay overtime, and we have to say they are not paying overtime because now it's June, July, and now August. The government passed a mandate to cut salaries. They have made some arrangements to adjustment, for the hours of work. But apparently nobody in the Ministry of Finance there thought through the process of how the overtime will look and how does the officer, what does the officer need to do to get these overtimes after they have worked for them. So for the past 3 months, the overtime has been going back and forth between the worker, and the staff are just now frustrated. So they haven't gotten their overtime payments for June nor July. And it is my understanding that they were to be paid at the end of August, but just last week they were informed that they are not even going to be paid at the end of August. So this is why the staff has said, okay, well, no problem. If you cannot afford the overtime, we just won't do the hours. The minister and the ministry, hands down to the administrators and the regional managers, and all these people come bearing down upon the staff. They want to get the service up and running. But nobody is saying, okay, you will definitely be paid the 1st of September, the 7th of September. There is no definite date being given to the personnel, but the people are there. Oh, well, you guys need to figure out how to run the shifts, but you have to provide coverage. How can you provide coverage when we are at short? If at 40 hours a week, we were having problems covering without overtime. When you cut down that 40 hours in a half-baked attempt to appease the citizens, the office, the workers, when you cut down on those hours to 35 hours, obviously, if you are already short at 40, how could 35 be a better coverage? So I just mentioned last week, over the weekend, that the sensible thing for the government to have done was say, okay, look, this 10% cut will not work for us. It won't work for the workers, it won't work for the government. Because if you cut salaries and you cut hours, then obviously the amount of overtime will rise. This is a department that is short before Corona.